from the Roscore Clinic in Blue Ball, but we're not going to ask him about water charges. We're going to ask him about headaches and hay fever and many other things. How are you, Emmett?
I'm okay, well, thank you.
Let's start with Jill's query. Jill is anemic. Now, in all the years, I'm not sure if we've explored this in any great detail. This concerns iron levels.
It does, yeah. It's quite a common condition, and it appears it's getting more common. The most common type of anaemia is iron deficiency anemia, and about 15% of females, especially females in their reproductive years, would have iron deficiency anemia. This would be primarily due to excessive menstrual loss, plus possibly the involvement of low B12, low vitamin B12, again, which is quite common. There are a lot of people are requiring pretty regular B12 injections to kind of keep them going.
So it's not simply a consequence of low red meat in the diet. There can be bodily factors here.
There can be other factors, yes. A very significant factor could be a lack of acid in the stomach, and this is becoming a bigger problem than... It's becoming a problem.
And the acid draws out the iron from the meat, is it?
The absorption of iron requires an acidic stomach, and as does the absorption of calcium, and as does the breakdown of protein. All of these things require an acidic stomach. And
so how does a practitioner narrow down the possibilities if there are so many things it can be?
Well, you just do the you do what's required as regards a proper medical case study, and ask the questions, and you can find out from that. You'll be pretty. It's something that you can nail down on a good case history. You don't really need that much. You don't really need blood tests. Okay, they'll confirm the level and you can measure response. But, the type of symptoms that will be seen in people with low iron or low and consequent low hemoglobin levels, hemoglobin carries the oxygen, so you're going to have less oxygen circulating in your body. So you won't be able to exercise as much. You'll be tireder. You'll have less energy. You may drop your weight.
But depending on the cause, there's not a one-size-fits-all solution, I presume.
Well...
let's say it's down to not having enough acid in the stomach to absorb or to facilitate the absorption of the iron. That's different than perhaps if there's a menstrual cause.
Well, sure, yeah, you address whatever are seen to be the main factors involved in the low iron and the consequent low hemoglobin. So... You may have to supplement with B12. Vitamin C is a key component in the absorption of iron, so supplementation with vitamin C is essential. The best supplement for iron deficiency is Floridex. There are other ones kind of like it, but it's the best.
Is it a temporary state? So after a few years, let's say in later life, will the issue subside?
Unless it's addressed, it won't subside. It needs to be treated. So from the herbal end of it, you would give herbs that would improve liver function. It's key involved. It's centrally involved in iron metabolism. You would give herbs to improve general digestion, supplement with vitamin C, possibly supplement with vitamin B12. You may refer the person to the doctor. They may need B12 injections. There's a hereditary component in some of these things, so that may involve having to be constantly watching your iron levels throughout your life, and this is a common thing.
Having addressed all that's practical to deal with, eventually might you be able to withdraw from treatment, or once you go on treatment, is it forevermore?
Not necessarily. If the person corrects the things that are involved that are part of the problem, the person may go on to live a normal life without any assistance. But initially, invariably, assistance is required.
Can you repeat as...
When people in the Midlands want to...